first started Acell Health. I was contemplating leaving a great job in corporate America. Fairly newly married, a couple of years. My wife's pregnant, and I walked in the door and said, I'm going to leave my job and start a new company. And I recalled the first instance of my wife's face, which was a bit of shock. And then she looked at me and said, I trust you, and if this is the right thing to do, let's do that. And it was a hard couple of years to get this business going and not knowing whether this was going to be successful or not. But I'm really glad I did it. It was one of those moments where it was sort of that very risky decision that you're sort of flipping a coin, and hopefully it was going to be heads or tails depending on what you chose. And I think I did okay, but that was a moment that sort of had that anxious butterflies in your stomach for a long period of time to get the business to where it's at today.
We were founded with a legacy scientific platform that was slightly different to the platform that we're currently primarily developing. That platform is still in clinical trials, and those trials are ongoing. But in 2021, we announced the initial clinical data from that platform, and that data wasn't obviously effective. It was the product still needed more exploration to assess whether we could really deliver the benefit that we wanted to in that time. The external reaction, as you can imagine, wasn't particularly positive, and we experienced probably a 9 to 12 month period where we needed to retool as a company to understand what our best path forward would be, knowing the people that we had and the resources that we had. One of the things I'm most proud about that moment is during that whole period, while there were all kinds of sort of discussions and rumors going on outside about what was happening at the company, we did not lose one single employee. That was key to the company. The leadership team remained constant. We were able to regroup, and we announced 9 months later what was CABA 201, which is currently the foundational product of the company today. That continuity, that ability to stay together and to really be a team through thick and thin is what has made us successful to date and what I think will position us for success in the future.
In the biotech space, things never go smoothly, as I'm sure everyone in the audience knows. But we develop autologous cell therapies, which means unlike your typical drug, which is say a pill that's massively produced, we're manufacturing cells uniquely for each patient. It's an N of 1 manufacturing cycle. We were the first to develop chimeric antigen receptors, macrophages, and test them in humans. Our very first patient happened to be a patient from UPenn, and their blood was drawn at Penn here in Philly, but our manufacturing site was in California. There happened to be a major snowstorm, and the blood can only last for so long. It lasts for a day or two, and we have to get it shipped over there immediately. All the flights were grounded. And this was our first patient. This was a pivotal moment for the company. So what we actually did was we chartered a private flight to fly a bag of blood about this big from Philadelphia to California so that we can manufacture this patient's cells. And the cells were manufactured successfully. We have a picture of the jet with the blood on board, which was a fun moment for the company. But we were committed to getting every patient's product manufactured and get the patients treated on our clinical trial. And this was a unique circumstance, but certainly one that I like to think about as overcoming an unexpected challenge.